Mr. Dodaro. I'm going to start with a round of questions, and then it looks like the next person up will be Senator Johnson. Mr. Dodaro, to date, GAO has made 121 recommendations on actions that Congress could take to address the wasteful spending and inefficient operations listed in the annual duplication report. There are currently 59 open recommendations. How should Congress prioritize which recommendations to address? Are there particular recommendations that you think we should focus on first?
I absolutely think those recommendations that have significant dollar savings potential ought to be among the top priorities.
Right.
You know, I issued a report last month. I've repeatedly warned Congress that the federal government's on an unsustainable long-term fiscal path. The more actions Congress could take to reduce federal spending, the more that situation will help be resolved over time. There's also very important sets of recommendations that go to improving public health and safety, and I'd also give those high priority as well. The recommendations we've made, for example, in this year's report about dealing with what's becoming, you know, we have about 50 million gallons of hazardous waste that we haven't got rid of, and our costs are going up every year. I mentioned the healthcare recommendations we have. There's the recommendations we have on biodefense strategies this year, very important. Recommendations on the pandemic. So my view, Senator, would be where it saves a lot of money and where it has a direct impact on public health and safety, those ought to be the top priorities.
Thank you. There are 8 new recommendations across 5 issue areas for Congress in this year's report. One involves allowing the Department of Energy to run a pilot program to examine alternative ways to dispose of nuclear waste. Why is congressional action needed here? How would congressional action on this particular issue prevent further wasteful spending and inefficiencies?
This deals with one of the biggest nuclear waste sites in Hanford, Washington. The government and the state of Washington have already agreed on how to dispose of the high-level waste, which they're going to vitrify, which is, you know, enclosing it in glass. Yeah. But there's 40% of the waste, supplemental low-level waste, that has not yet been decided how to dispose of. The Department of Energy right now, with our encouragement, is testing using a grouting process which would be far less expensive than the vitrification approach, and then transporting that waste to a location in Texas that's already licensed outside of the state of Washington. There's still some disputes between Energy and the state of Washington that could potentially take this pilot test into litigation that would slow it down for years. And we're concerned that this is only dealing with a couple thousand gallons of waste. And so Congress, by clarifying that this is an approved project for that to go forward with, would give Energy the option. If they could use grouting instead of vitrification, they would be able to do this a lot faster and a lot less costly, thereby both saving money and protecting public health and safety.
Thank you. This year's duplication report also notes that 200 federal programs across 21 agencies exist to combat diet-related chronic health conditions. GAO recommends that Congress assign a single federal entity to coordinate these programs and develop a national strategy to reduce inconsistencies in policies and better manage resources for helping Americans struggling with these conditions. So 200 overlapping programs do not pop up overnight. Different perspectives and programs may be helpful in some cases, but it's hard to believe that having that many programs is the best approach to addressing these issues. How did we get to this point? How can Congress or agencies prevent this kind of situation going forward?
Well, first, this situation was similar to what we've reported on our prior reports. For example, we found 150 STEM programs across many different agencies, a lot of education and training programs. So they develop incrementally over time. Programs are never looked at to make sure they're working effectively, so that if there's a perceived need, there's always the creation of a new program rather than making the current program work effectively. So it has that similar pattern to it that we've seen in the past. Now, Congress took action. We've reduced the number of STEM programs, the number of educational working programs. I think something similar here could be done, but we need a strategy and need input from the agencies. Now, legislation that you've introduced and Senator Paul have introduced requiring the agencies to focus more on identifying overlap and duplication programs. There's really not a process in the executive branch to do what we're doing at GAO, and it should be done. Now, a complicating factor here, as Senator Langford knows, there's not a ready program inventory yet,
right.
So people could look across the government and identify these programs. We spent an incredible amount of time and effort to dig this information out across the government. There's efforts being made to develop such an inventory, but your legislative proposals would require each agency using OMB's guidance to identify these overlapping programs. OMB is really in the proper perspective looking across government to help deal with this issue across agencies. And then Senator Paul has a legislative proposal that would require GAO to look at new programs to see if the work that we've already done would indicate that those programs may be duplicative of existing programs.
Well, thank you for that. Yeah, I've introduced a bill with Senator Braun that would require agencies to identify duplicative or unnecessary programs and work with Congress to eliminate them. And I take it from your comments just now, you think that OMB might be the right kind of point of nexus, for instance, for these 21 agencies who are operating the programs that you highlight, the 200 programs to combat diet-related chronic disease, might be a good convener of a process.
Yeah, it has to be OMB because the agencies have limited visibility on what's going on across the government without the program inventory. They also have parochial interest to protect, and so you need a neutral arbiter to help identify and eliminate some of these programs. OMB could play that role, but quite frankly, they don't really have the bandwidth and the resources necessary to deal with all these issues. So designating a lead agency to do this with support and oversight from OMB would be the way to go, in my opinion.
Okay, thank you very much. Senator Johnson, you're recognized.
Gene, welcome back.